So this is Dr. Jacob Lilly here, back with another video, and I'm going to be talking about 5 reasons why your lower back continues to hurt. Now, this research has been compiled from 2 very prominent doctors in the space of musculoskeletal injuries, such as Dr. Stuart McGill and Dr. Craig Liebenson. So today I'm going to be discussing 5 things that I've picked up from their readings, their textbooks, their articles, and their research, and 5 things that I commonly see with patients that often come into my office regarding their lower back pain and what we can do to help with that. So the first thing on this list is actually improper breathing mechanics. Now, many of you may not actually know that you're breathing improperly. And yes, there is a proper way to breathe. Now, most people, when they think of breathing, think about taking a deep breath in, talking about relaxing. However, when they do take that deep breath in and inspire, they're actually breathing through their chest using these intercostal muscles and oftentimes these neck muscles to help pull that rib cage up to try to create a vacuum and thus pull air into our lungs. However, that is not the way to do it. So a little quick check that you can do at home to test whether or not you're doing this properly is actually put a hand on your chest and a hand on your belly. Take a deep breath in, and as you take that deep breath in, you should feel your belly rise more so than your chest. If you feel like your chest is rising up and your belly is kind of sucking in, that is an improper way to breathe. That is not what we want, and that has implications when it comes to lower back pain. The type of breathing that we're talking about here is actually called diaphragmatic breathing. This is very important because as we engage the diaphragm, which is the primary respiratory muscle, which it helps pull down our rib cage, creating a vacuum to help pull air into our lungs and thus get oxygen and then expel carbon dioxide. Now, the reason this is so important is because as we take a deep breath in through our diaphragm, we're actually activating a lot of our smaller core muscles that we often don't really think about when we think about training. This term that we call it is called co-activation. So when we take a deep breath in and inspire through our diaphragm, what we're actually doing is creating a co-contraction of many different muscles in our core. There's several of them that you may need to know. A lot of them, most of us kind of have an idea of what they are, such as the rectus abdominis, which are our six-pack muscles. We have the obliques, internal and external. We also have the lower back muscles, and there's plenty of them there that I'm not going to list off in this video. Now, when we take that deep inspire through our diaphragm, that rib cage gets pulled down, and what that does is that sucks air into our belly and expands that core. Now, what that does is that creates a high pressure system. So whenever we're doing certain activities or doing certain lifts when we're exercising, that's going to help keep stabilization in our lower back and help protect the segments of our lower back as well as the discs. So a lot of the time when I deal with lower back pain patients, I always talk about breathing with them, particularly diaphragmatic breathing, because if they have this improper chest breathing mechanics, they're going to lose that co-activation, and oftentimes that is just a missing link that they do not have, and so they need teachings of that to help properly stabilize that lower back. Moving on to our second thing is a term called gluteal amnesia. Now, what this basically refers to is essentially whenever we're involved with tasks in the lower body as well as the upper body, such as deadlifts, such as squats, such as getting up from a chair, going upstairs, there's an altered motor pattern or an altered firing pattern with our glute muscles, and that often is accompanied by prolonged sitting. Now, essentially what gluteal amnesia is this dulling sensation of motor firing patterns. So basically our mind's ability to properly send signals to the glutes to contract and activate tends to be a little bit delayed or dulled, and this can create altered firing patterns. And this can create altered firing patterns with our lumbopelvic rhythm. Now, the implication of this is essentially that if we have this gluteal amnesia, which again is very common with people who do prolonged sitting, such as sitting at a desk, sitting at a car, other examples of that, what this tends to do is as we tend to stand up and contract the glutes, with this delayed firing pattern, we're actually utilizing a lot of our other muscles to accommodate for the prime mover of the hip, which is the glutes. What we're doing is creating a compensation pattern with our lower back muscles and hamstrings typically to compensate for the lack of glute engagement. Now, the implications of this is we tend to have, again, altered movement patterns at this point. So an altered firing pattern then turns into an altered movement pattern, and how we're moving is what we're doing day in and day out every single day of our life. Think about walking. Whenever we're walking, we're supposed to engage the glutes every time our leg goes back into hip extension. However, if you have this gluteal amnesia and you're reinforcing this altered movement pattern, we're going to be actually engaging our lower back muscles, our erector spinae muscles, and our hamstring to achieve that hip extension to compensate for the lack of glute engagement. Now, this in itself isn't wholly problematic. However, with this lack of glute engagement, we're going to lose stability in the pelvis, which then has implications in lower back pain and instability. Now, with this altered stability, this is where we're going to have issues with pain and discomfort and stiffness because there's just too much movement and your body doesn't know how to correctly activate the muscles necessary to provide adequate stability. Now that's going to lead us into our third category, which is previous injuries. Now, previous injuries, especially in the lower back and spinal segments, can actually lead to altered firing motor patterns, just like we talked about in the gluteal amnesia section. Now, this is more so related to the individual muscles that create proprioception as well as aid in stability in our spinal segments. It has been well documented, especially by Dr. Stuart McGill, again, who's a very prominent professor and researcher with lower back pain and lower back issues. He basically found out that whenever there's an injury to the spine, there's going to be some altered neural recruitment of those muscles. Now, just for those of us who don't know any physiology, whenever we send an impulse from our brain to our muscles to create a contraction and thus a movement, we're actually sending a neural impulse. That neural impulse will actually activate the muscles, which will then contract it and thus create movement. Now, when there's an injury, that pattern that we call upon to recruit the muscles and engage in movement is actually altered. And similar to the gluteal amnesia, there's going to be this actual altered firing pattern between the neurons and the muscles, creating this stimuli that's not so smooth and can create issues with stability with our lower back. Another thing to really consider when we're talking about lower back pain is that oftentimes people take the advice of resting when they have lower back pain. Now, in most cases, this is actually the wrong thing to do. When you rest, you're actually not putting any stress or motion in these muscles and these joints, these ligaments that are going to help speed up that recovery process. Now, when we actually rest, we're actually doing something that's very debilitating to the muscles and causing atrophy. Okay? If you are in bed rest for over 2 days after an injury, this can have problems with the muscle activation that again is going to create stability and help promote movement in a correct fashion. So what we do not want to do is after an injury is sit in your bed or sit on your desk or whatever it is to just rest it for more than a day or two, okay? In certain extreme cases where it's very debilitating, that might be the correct course of action, but in most cases, probably 8 out of 10 or even 9 out of 10 cases, most lower back pain is not going to be debilitating. Now, that's going to lead us into our fourth thing, which is actually something called nociceptive system sensitization. Now, all that basically means is that our ability to feel and interpret pain is actually enhanced. Now, the way this usually occurs is actually, again, after an injury. So once there's an injury, let's say in a acute lower back pain injury, let's say you bent over, you went to pick something up, and as you were coming up, you felt that shocking sensation in your lower back. Now, that is an acute injury. Now, what happens is if you do not do anything about that, there is a chance that your nervous system will actually interpret that pain a little bit easier next time. So let's say you don't get it fixed, you don't do any rehab to address the stability elements, or you don't do any rehab to promote any of the endurance or strength elements with your lower back and your core muscles, and you do that same exact thing a few months later and you injure yourself, it's going to be a little bit easier to feel that pain, recognize that issue, as well as it might be a little bit easier for you to actually injure yourself because there wasn't proper rehab installed in the first place. Now, what this then does is that it creates this recurring pain cycle, the inflammation cycle that occurs, which causes pain. But then that is then sustained because the nervous system is now adept at catching pain and interpreting pain a lot easier. So again, whenever there's an injury, it's very easy to make that injury a more chronic issue through this nociceptive system sensitization process. Now that's going to lead us into our last point, which is intolerance to load or positions. Okay. Now what this basically means is that as we move or as we are in sustained positions such as like sitting or what most people think about as posture, there's going to be some intolerance to that, which then can lead to pain. Okay. And I'll explain it and break it down as such. So if you're sitting for long hours of time, let's say you're sitting at a desk, that's your primary occupation, where you're sitting at a desk for 8+ hours a day, and then you go home, and on your way home, you're sitting in your car, and that's a 45-minute drive, and then you go home and you sit on the couch. You're sitting for more than just 8 hours. You're sitting for a very long time. Now, what this does is that it creates a sustained load on your discs, on your ligaments, on your spinal segments, on the muscles, which then can lead to injury if it's overloaded. Now, this is when it becomes an intolerance problem in strength and endurance. And this is when rehab becomes very important as a form of treatment. So if you're sitting for these long periods of time, but your body, again, is being broken down by that, and you're not doing anything to accommodate for that and try to either fix that issue, get rid of that issue, or strengthen it so you can become more resilient to that issue, that's when we're going to lead into problems of intolerance and thus pain. When we have this intolerance, it's usually an accumulation of certain movements or certain positions, again, like posture, that can lead to overloading these tissues, which then can cause inflammation and thus pain. Okay? In certain examples, if you're used to bending forward and picking something up from the floor many times over and over and over and over again, let's say like a factory worker or someone who works in a warehouse, and they're not lifting through their hips and through their glutes and just using their lower back to flex and extend, that's going to lead to an overload of tissues, particularly in the discs. And when they go to do that, let's say at home, that's when they're going to have that initial acute injury. However, the actual bending forward that one time where you felt that pain wasn't the actual injury. It was an accumulation of several hours and days and weeks and months of injury to the tissue without proper recovery, proper rehab to sustain that overloading process, and thus become more resilient and anti-fragile to sustain that load. So there it is. Those are our 5 reasons as to why our lower back pain continues to ache and continue to hurt, especially after treatment or after an injury. There needs to be certain things that needs to be put on your responsibility to help with these things. Proper diaphragmatic breathing, which again increases stability in our spinal segments by creating a co-contraction of our core muscles. Gluteal amnesia, which again is if we're sitting for long periods of time, there tends to be this altered firing pattern between our neurons, our nervous system, and our glute muscles, which create contraction of the hips, which again is a very big stabilizer of our lower back, as well as creates altered movement patterns if we're having this gluteal amnesia, which again can lead to other injuries. When we're talking about previous injuries, again, if there's an injury that you've sustained in the past, there's a chance that there's this change in motor patterns and motor recruitment of muscles, which is going to create stability and support our spine. We may be lacking in that area because of a previous injury that we just neglected and just kind of got over. Okay, I see this a lot typically with people with ankle sprains, that if they have recurring ankle sprains, they kind of just walk it off, they'll throw some ice on it, and they're fine in a couple days. However, that can lead to implications later in life with chronic ankle instability, which can lead to issues in the knees, in the hips, and the feet. But that's just one example. We talked about nociceptive system sensitization, which again is the nervous system ability to feel and interpret pain a lot easier than we normally would or should. Okay, this is technically a negative thing because if, let's say, you pinch your skin and it doesn't normally hurt, the idea of nociceptive system sensitization is that if you pinch your skin again, it's going to feel a lot more painful than it normally should. That's essentially in a nutshell what that is. Okay, and that usually is sustained after chronic injury. That again is going to lead us into our next point, which is intolerance to certain positions or certain movements. Now, the intolerance, again, is usually occurring because of such sustained movements or sustained motor patterns that we're doing that's causing chronic stress to tissues. And this chronic stress eventually overloads the tissues and then creates an injury. usually through inflammatory pain. So those are our 5 reasons why your back continues to hurt. So if you guys have any questions, please leave a comment below. Make sure to like, subscribe. Thank you guys for watching. We'll see you again in the next video.